Hey fellow lab rats, this is Rebecca from the Lab Rat YouTube channel. In this video, I'm going to be demoing the manual urine dipstick test. All right, let's get started. Okay, so in this video, I'm going to be showing you how to perform a manual urine dipstick test on of course, a urine sample. So a urine dipstick consists of a series of pads that are embedded on a reagent strip that provide a semi-quantitative assessment of various potential contents of urine. So here is my bottle of urine dipstick. So this is specifically, the brand is ChemStrip 10 UA. This is a Roche product. And if you notice here in this vial, I have a lot of these strips. So it's important to note for doing these testing, you only want to pull one strip at a time. You don't want to pull them all out and then pick one. You want to keep these dry and away from moisture. And also, before you start this test, you want to check the expiration date as well. And if any of the pads look kind of funky, get rid of that one and start with a new one. So on the side of this bottle here, it shows you the different reagent pads that we are going to be testing this urine on. So there's specific gravity, pH, leukocyte esterase, nitrite, protein, glucose, ketones, urobilinogen, bilirubin, and erythrocytes, which are red blood cells. And also on here, it tells you the specific timing that is required. So once you dip the urine, you have to read it at this particular second. So most of these are 60 seconds. The only one that's different for this specific brand is leukocyte esterase, that is 60 to 120 seconds. So what it shows you is, so what we're going to do is we're going to dip this urine in here, and we're going to set the timer, and then we're going to compare the color of the reagent pad to these levels, and that's how we get our result. So I'm going to go ahead and do that here. So again, I have this here, this reagent pad. I've got my fresh urine, and this is at room temperature, so it has not been refrigerated. I've got my timer set for a minute, which is 60 seconds, and then I have my resulting sheet. I'm going to call this patient Lab Rat. How convenient. Today is January 17th, 2023. And then here are all my result windows. And then I'm going to be labeling this patient's results on this form. Okay, so I'm going to remove the top of this urine container. And I'm going to take one of these reagent strips. So you see how they have little different pads on them? So those pads are going to be changing color based on the contents of this urine. All right, so I'm going to take this strip and I'm going to dip it all the way into the urine, make sure all the pads are saturated with that urine, and then I'm going to pull it out and kind of put it to the side so that way all the urine drips back in, and then I'm going to tap it to the side and then set my timer. All right, and I'm going to close my urine and wait for that 60-second timer. So I said semi-quantitative. So what does that mean? So if we were doing a quantitative test, I would be saying, okay, so the amount of leukocytes present in this sample is 102.37. It's an exact amount, all right? Now, a qualitative test is yes or no, or positive or negative for, leukocytes, white blood cells. Right? So this is a semi-quantitative test, meaning it tells you more than yes or no it's present, but it doesn't give you an exact number. It gives you a range. So like, for example, the glucose, right? So glucose is read at 60 seconds, and it gives you a normal result, 50, 100, 250, 500, 1,000 milligrams per deciliter. It's a semi-quantitative. It's not an exact amount, but it's a good range. So that's what we mean by semi-quantitative. Okay, all right, our timer is going off. Let's take a look at these. Okay, so if you notice here, it says the strip handle is up here. So this is how we want to read it. Okay. So for specific gravity, we're going to compare it to what color it looks like. It looks like 1.005 for me, so I'm going to write that down. All right, pH. Oh, that's right at 5. Excellent. So I'm comparing it to these colors. So 5.0. Look at my leukocyte esterase. Oh, that's actually really positive. So that is going to be, I'm comparing it to these squares here. So this is going to be a ++, so that's a large reading. Nitrite is negative, okay. Write that down. And I'm going through these kind of quickly because they do have to be read at 60 seconds. My protein result is also negative here, as well as my glucose result. So I'm going to put negative for those. And then our ketone result is also negative. That's good. And then our urobilinogen result, that is a normal reading. All right, 2 more here. Bilirubin, so I'm going to be comparing these to this pad. This is definitely a negative result. And then erythrocytes, so these are red blood cells. So hopefully you could see, it's kind of hard to see on this. It is not a negative result. There's a little bit of green dots in it. So that is comparable to trace, which is right here. So I'm going to write trace. Okay. Now what I'm going to do is I'm going to take this and I'm going to discard it in the trash and then put this away for proper storage. Now, if you have not watched my urinalysis videos yet, go ahead and do that as well. And I will go into great detail about what all of these results mean. But this was just kind of a demo of how to do the urine dipstick test. Hopefully this helped. Alrighty, if you like this video, go ahead and give it a like, and please make sure to subscribe to my channel for more educational laboratory content. And as always, if you have any questions about this particular video, or if you have any suggestions on what things you would like to see in the future on my channel, please go ahead and leave those into the comment section below. Alrighty, until next time.